Hello and welcome to Baby's World season premiere, exclusively airing on ETV Kenya and all social media platforms. My name is Furaha. I'm your host. Let's get started. It's such a wonderful experience to share this show with you, inspired from my own experience as I was transitioning to be a mom. From the time I was pregnant, I really didn't know so much about pregnancy and its journey. I learned it along the way. And in the process, I was like, whoa, I would want to know more about this. And I engaged my friends and who were also new mothers, and they also went through a similar challenge that I was going through. And I really felt this show would be so much of help to every woman who is transitioning to motherhood. And even our mothers, when they raised us when we were young, they were also battling with 1 or 2, 3 challenges when they were raising us up. And we would want to be also ready to empower every other mother who is outside there and would want to raise their young children. Many have different stories and experiences, and others who are coming in, we would want to share some knowledge to empower you, learn, grow, and nurture your little one as they develop. My name is Furaha, and welcome to the Baby's World. Let's get started. On our first episode of The Baby's World, we'll be featuring pregnancy and gestation. What is pregnancy? Pregnancy is the term used to describe the period in which the fetus develops inside a woman's womb or uterus. Pregnancy lasts about 280 days or 40 weeks. Let's learn pregnancy and how it occurs. Pregnancy occurs when a sperm fertilizes an egg after it's released from the ovary during ovulation. The fertilized egg then travels down into the uterus where implantation occurs. A successful implantation results in pregnancy. On average, a full pregnancy lasts 40 weeks. Did you know pregnancy period is called gestation? It is the period of time between conception and birth. During this time, the baby grows and develops inside the mother's womb. What are the symptoms of pregnancy? Oh my, oh my, oh my. Missed period, yes, is one of the earliest symptoms of pregnancy and may be the most classic one. However, a missed period doesn't necessarily mean you're pregnant, especially if your cycle tends to be irregular. There are many health conditions other than pregnancy that can cause a late or missed period. Another symptom of pregnancy is headache. Headaches are common in early pregnancy. They are usually caused by altered hormonal levels and increased blood volume. Contact your doctor if your headache doesn't go away, or especially if it's painful. Another symptom of pregnancy is spotting. Some women may experience light bleeding and spotting. This bleeding is most often the result of implantation. Implantation usually occurs 1 or 2 weeks after fertilization. Early pregnancy bleeding can also result from relatively minor conditions such as an infection or irritation. The latter often affect the surface of the cervix, which is very sensitive during pregnancy. Bleeding can also sometimes signal a serious pregnancy complication such as miscarriage, ectopic pregnancy, or placenta previa. Always contact your doctor if you are concerned. Weight gain is another symptom of pregnancy. When you experience weight gain, you can gain up to between 1 and 4 pounds. Weight gain becomes more noticeable towards the beginning of your second trimester. Pregnancy-induced hypertension is another symptom of pregnancy. High blood pressure or hypertension sometimes develop during pregnancy. A number of factors can increase your risk, including being overweight or obese, smoking, having a prior history or family history of pregnancy-induced hypertension. Heartburn. Yes, hormones released during pregnancy can sometimes relax the valve between your stomach and esophagus. When stomach acid leaks out, this can result to heartburn. Another symptom is constipation. Hormone changes during pregnancy can slow down your digestive system. As a result, you may be constipated. Cramps, oh my, this one I have also experienced myself. It's so painful. As the muscles in the uterus begin to stretch and expand, you may feel a pulling sensation that resembles menstrual cramps. If spotting or bleeding occurs alongside your cramps, it could signal a miscarriage or an ectopic pregnancy. Back pain is another symptom of pregnancy. Hormones and stress on the muscles are the biggest causes of back pain. In early pregnancy, later on, your increased weight and shifted center of gravity may add to your back pain. Around half of all pregnant women report back pain during their pregnancy. Another symptom is anemia. Pregnant women have an increased risk of anemia, which causes symptoms such as lightheadedness and dizziness. The condition can lead to premature birth and low birth weight. Prenatal care usually involves screening of anemia. Depression. This is very common. Between 14 to 23% of all pregnant women develop depression. During their pregnancy, the many biological and emotional changes you experience can be contributing causes. Be sure to tell your doctor if you don't feel like your usual self. Insomnia. Insomnia is another common symptom of early pregnancy, which involves like stress, physical discomfort, and hormonal changes can be contributing causes. A balanced diet, good night's sleep, or good sleeping habit all help you get a good night's sleep. Breast changes. This is very true. Breast changes are one of the first noticeable signs of pregnancy. Even before you're far enough along for a positive test, your breast may begin to feel tender, yes, swollen, and generally heavy or full. Your nipples may also become larger and more sensitive and the urethra be darkened. Acne, yes, pimples. Because of increased androgen hormones, many women experience acne in early pregnancy. These hormones can make your skin oilier, which can clog pores. Pregnancy acne is usually temporary and clears up after the baby is born. Yes, after the baby is born, your pimples will clear up. Vomiting is another symptom of pregnancy, a common symptom that usually appears within the first 4 months. Morning sickness is often the first sign that you're pregnant. Increased hormones during early pregnancy are the main cause. Hip pain. Oh yes. Hip pain is common during pregnancy and tends to increase in late pregnancy. It can have a variety of causes, including pressure on your ligaments, changes in your posture, and a heavier uterus. Diarrhea, oh yeah. Diarrhea and other digestive difficulties occurs frequently during pregnancy. Hormone changes, a different diet, and added stress are all possible explanations. If diarrhea lasts more than a few days, contact your doctor to make sure you don't become dehydrated. Stress and pregnancy. While pregnancy is usually a happy time, it's also a source of stress. A new baby means big changes in your body, your personal relationship, and even your finances. Don't hesitate to ask your doctor for help if you begin to feel overwhelmed. The bottom line, if you think you are pregnant, you shouldn't solely rely on these signs and symptoms for confirmation only. Make sure to take a home pregnancy test or see your doctor for lab testing and confirm your possible pregnancy. You are watching The Baby's World. We take a short break. We'll be right back. Thank you so much for watching The Baby's World. We look forward to having you in the next episode. I'm your host, Furaha. Thank you very much.